afternoon everyone, myself Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about pelvic motion. So there are four bones that make up the pelvic girdle: ilium, sacrum, coccyx, two hip bones, ischium and pubis. And the pelvic girdle is also referred to as pelvis. So the joints in the pelvis girdle are as follows: right and left sacroiliac joint, symphysis pubis and lumbosacral joint. So what is the function of pelvis? It supports the body weight through the vertebral column and passes that force into the hip bones. Then it also receives the ground reaction forces during walking and transmit them upward towards the vertebral column. It supports and protects the pelvis viscera, provide attachment site for various muscles, and make the bony portion of the birth canal. So the motions available are nutation. It is sacral flexion, that is anterior rotation of the sacrum in relation to the ilium. The base of the sacrum on the superior end moves anteriorly and inferiorly. Then counter nutation, sacral extension, that is posterior rotation of the sacrum in relation to ilium. The base of the sacrum moves posteriorly and superiorly. Then in this figure, in these figures, nutation and counter nutations are shown, like superior, inferior, posterior, anterior. These are the directions according to which the nutation counter nutation is usually shown. So in the first figure, nutation is shown, and in the second one, counter nutation is shown. Particularly it is of the left pelvic bone. These are same named action as when pelvis moves at hip joint: anterior, posterior tilt in sagittal plane, elevation and depression in the frontal plane, and right and left rotation in the transverse plane. So the motion of pelvis as a unit at a hip joint. So first we are having the flexion of thigh, then anterior tilt of the pelvis. With extension of thigh, there will be the posterior tilting of the pelvis. Next, with the hip abductors, abduction of the we can say the right thigh, there will be the depression of right pelvis and elevation of the left pelvis. With hip adduction, elevation of the right pelvis and depression of the, we can say, left pelvis. So in this, there will, with the lateral rotation of the right thigh, there will be the left rotation of the pelvis. And in the second figure, with medial rotation of right thigh, there will be the right rotation of the pelvis. So the motion of pelvis as a unit relative to lumbosacral joint. So with flexion of the trunk, posterior tilt of the pelvis, and with extension of the trunk, which include done by the paraspinal, it leads to anterior tilt of the pelvis. So with the right lateral flexion of the trunk, which is usually done by the flexor muscles, there will be the elevation and elevation of right pelvis and left pelvis. So in this figure, internal external rotation is shown. So next we are having the muscle control. So basically, when the hip is flexing, or we can say the hip is in flexion, at that time the pelvic tilt anteriorly, and with hip extension, the pelvic tilt posteriorly. At that time, hip flexors along with back extensors are working in when the pelvic is tilting anteriorly, and during the posterior pelvic tilt, hip extensors along with trunk flexors are active. So thank you.